I'm Beth Perrell. My guest today is Marni Stahlman. She's president and CEO of Shepherd's Hope. We're going to be talking about health issues and how people can access support from Shepherd's Hope. Marni, why don't you give us that usual thumbnail of what Shepherd's Hope is all about?
Sure. Thank you for having me. Shepherd's Hope is a free and charitable clinic here in Central Florida with 5 locations, and we provide free health care to the uninsured and what we call underinsured. And when I say free, I do mean free. Individuals can come to one of our clinics. They don't need to make an appointment and meet with a physician, clinical provider, with what might be presenting, whether it's an acute disorder or something that's more chronic. We don't suggest if you need an emergency that you come to Shepherd's Hope, but we're like an ambulatory outpatient traditional clinical practice.
And some of the people do come to you with insurance. They just don't have enough for copays and stuff, and then some don't have insurance at all?
No, they don't have insurance at all. For
None of them.
individuals that come to us and they might have insurance, but they're having difficulties with copays, there are individual community resources that we refer them back to.
I gotcha.
That can help them with that assistance. Shepherd's Hope purely just sees people with 3 criteria. They have to be at or below 200% of the federal poverty guidelines. What is that? That's for an individual about $24,000 annually, and for a family of 4 about $43,000 annually. They have to not be currently enrolled in a Medicaid or Medicare program, that's a federal program, or they simply have no health care insurance whatsoever. Any one of those 3 criteria, and they can be seen at a Shepherd's Hope clinic.
Talk about the volume each year.
Well, it's been interesting. We've been tracking, and as I've been talking with you and your listeners, we've seen about a 22% volume or capacity increase since 2012. And it's been in some very interesting areas. Predominantly, our patient population is about 58% women. About 10% are children below the age of 18. So we don't see a large population of children, but we do see quite a number that are in that younger toddler vicinity. And when we do see them, we try to get them enrolled in programs like Kid Care that is here in Florida so that they can get coverage. But we're also seeing some interesting changes in that about 43% of our patients told us last year they were fully employed. So when I often go out and speak to the community or have opportunities to tell people about Shepherd's Hope, when I describe our patients, I say this: it's exactly who you think it is and who you'd never imagine it to be.
So it's hard to figure out the trends. And in fact, we assume now that we're all supposed to have insurance, right? And that there is access to insurance. So that's been interesting to you over the past year anyway, simply because of funding and because of sort of people in that donut.
The gap. We call it the coverage gap. So in a wonderful way, Central Florida in particular, I think it'll be announced sometime this week, is 5th in the nation leading in enrollment into the ACA program. But Florida is not a state that has a state exchange. It has a federal exchange. And while there are opportunities to qualify for subsidy assistance, that's based on your income, we're seeing quite a number of people that come to Shepherd's Hope who are fully employed, who don't have access to health care coverage through their employer, and when they go to the exchange to purchase it, they're finding that while they might be able to afford some portion of the premium, it's got a $12,000 deductible or a $60 copay for a doctor's visit, and it's out of reach for them, and they don't qualify for the subsidy assistance because they're out of the income range that would qualify them into that. So it's kind of an interesting mix of patients now that we're seeing, where we traditionally were seeing those individuals that you would think of, as I said, that would be folks that need the safety net, that they're working poor, that they're at or below those poverty guidelines, just trying to get by. We also see individuals on the other end of the extreme as well. And so that's where we've had kind of this mashup, as you've said, of different kinds of patients. And then the other thing that's characteristically been very impactful for us is the patients that are coming are sick. They're really sick. They're chronically sick because they've put off seeking healthcare assistance or an intervention. So a female, just today, we had the Florida Hospital Healthy Women 100 mammography mobile coach at our Longwood Healthcare Center. In fact, they were providing free mammographies to our patients. We had about 20 women get up onto that bus. And it's not unusual for us to have an individual woman come to the clinic presenting with a respiratory infection or something that's going on with her on an acute basis, and we ask her, when was the last time you had a mammogram? And she says 8 years. We get the mammogram for her, and we find out she has breast cancer. And those are the kinds of patient stories that we're seeing a lot of.
Now, you're not trying to be the primary care physician, right?
We're not a medical home.
What do you
no.
do with something like that?
Well, first we try to make sure that we get as much in place for her as possible, where we access our community resources, our community partners. All of the 4 hospital systems, Florida Hospital, Orlando Health, Central Florida Regional, and Nemours, are all integrated into the continuum of care. So we access them and we call on them to say, can you help us? But they have limits as well of how much they can extend. And it's difficult. We have a waiting list in our case management system. We call out to Moffitt over in Tampa. We call out to Shands up in Gainesville, wherever we can across the state to try to get these resources for these folks that really will need something more serious for the intervention, and do our best. And that's been the difficulty specifically for this year, because we have not been able to do as much, I think, as we would have hoped or liked or been able to compared to the prior year. We had some funding collapses that have really constricted what and who we can see.
Now, you're funding, so the physicians and the nurses, they're all volunteers?
Yes.
Okay, so where does the funding go specifically? I'm guessing equipment, if nothing else.
Equipment, prescriptions. So one of the things, if you come to Shepherd's Hope as a patient, as you would to your own natural doctor, right? If you're going in with a respiratory infection, he may or she may prescribe a Z-Pack or a Pred-Pack. You know, my daughter just had croup, so she got put on a bunch of different things. Generally speaking, after you go to the doctor because you're sick, you leave with a little piece of paper that says, take this to CVS or Walgreens or Publix and get a prescription, right? Well, our patients don't generally have the funds to be able to do that. And so one of the things that we also provide, in addition to the care itself, is a prescription and a voucher that they can get a prescription for up to 90 days. That costs us about $50,000 annually for the amount of patients that we have. And that's where some of our funding goes. And so we've had to pull back. Believe it or not, all the things that you would think of in a outpatient physician's practice, we have to buy rubber gloves and masks and cotton balls and tongue depressors and injectables and all of those kinds of things, because as I'm fond of saying, life is like a box of chocolate at Shepherd's Hope. Every day you don't know what you're going to get because their patients can't make appointments. And so they're going to come and we're going to greet them that day or that evening not knowing what's there. So we have to be prepared, and that's expensive.
But it sounds like you have to say no sometimes.
We do, and that's a very hard day for our doctors. It's a very hard day for my team. We try not to do it very often, but we've been forced to have to do it more than we would like. Last year, we had to close a total of 11 nights across our locations because we didn't have the capacity to meet the needs that were there, because we didn't have a licensed clinical provider that was available to volunteer. On an average night, we see between maybe 30 to 35, maybe 40 if it's a good night patients, but oftentimes we're turning away 5 or 6 or 10 a night across multiple sites. That starts to add up. And last year, that was almost 1,100 patients.
So how's it going to be this year? And let's talk about the decisions made in the legislature. And I know you had a little bit in the paper. We had a really good
day yesterday and Friday with the legislature. We didn't have a great year last year. And Shepherd's Hope is a member of the Florida Association of Free and Charitable Clinics, proud member of other free clinics around the state that are all doing great work. Another one that is here in our local community, many of you may have heard of, is Grace Medical. They're a sister agency with us in the association. And we were part of the veto group last year, the association was. And those are dollars that come down directly from the state association to clinics like Shepherd's Hope and Grace as grants. And so last year, that was almost $160,000. And it's on a fiscal year, not a calendar year, because it's the state of Florida. Their state budget starts on July 1st. So we're actually still only halfway through the experience of the loss of those dollars. This week, when the legislature adjourned and gave their budget recommendations to the governor, the appropriation was back for the Florida Association of Free and Charitable Clinics. And thankfully, we were not vetoed this year, but those dollars won't arrive until after July 1st. So again, we're not out of the woods yet. It'll help for next year, but for the patients that are coming now, it's still hard.
Well, maybe this is a good time then to talk about one of your fundraising benefits each year. You hold a fundraising breakfast.
We call it a friendraiser, too, because we want to create as many friends as we do funds.
Okay.
Because our volunteers are incredible resources. So we'll always accept a philanthropic donation, but sometimes a person's time is even more valuable, because if we can get a physician to come and volunteer, that's more patients we can see. So our friend fundraiser will be and is called Call to Hope. It will take place this year on April 5th from 7:45 registration, 8 o'clock program start. We promise to get you out right away in that full hour, and it's going to be held at Rosen Shingle Creek. And we're very blessed this year that Mr. Rosen has chosen to partner with us and assist the organization in helping to undercut some of the costs associated with a fine breakfast and bring the opportunity of about 500 community leaders, individuals, folks that today might be listening are more than welcome to come. It's free, and you can hear some of the stories of our patients, why it's so incredibly important that the organization be supported and sustained in the community. And we also have our Volunteers of the Year, which is always a surprise announcement. So I'm not going to say today I'm not giving any dish today, but we have 4 categories of volunteers, and they're nominated by the core of volunteers and health center workers and managers that we have in our clinic. So it's not something from top down, it's from bottom up. And we announce it that morning, and it's quite an event. And usually the people that are there in the room have no idea, and it's one of the most special things that we do, because it's our way to say thank you to these men and women who come so selflessly to volunteer their time and their heart to patients that are just really with so much less than what we think.
Tell people how to register.
Well, they can go to our website, which is www.shepherds. Now, here's where it gets complicated, and sometimes people get confused because Shepherds is spelled with us with 2 E's. So it's SHEPHERDSHOPE.org, shepherdshope.org, and you'll click on the events tab up at the top, and it will say Call to Hope, and you can register right online. And again, as I said, there's no cost to attend. It's just your time.
You've already shared one of the stories with us today of someone who was helped. You want to share another one?
Well, every day is an amazing story. We've had a number of women lately over the past couple of weeks that have presented with various types of cancer. And that has really kind of been more unusual than I think we've seen in the past, and has really driven home the feeling, at least among some of my peers, that as women, we are sometimes the last ones to take care of ourselves. We eat cold food, right, because everybody's eating ahead of us, or sometimes not at all, or we'll eat our leftovers from our kids, and we'll always seem to put our needs, I'll take care of that another time. Right now I have to pay my priority to this. And what we're seeing is, I think, a lot of, I'm seeing it more prevalent, I think, or maybe I'm just more aware of it as I go through that myself, in women that are coming, that if they had come sooner, we might not be delivering some of the diagnosis that we have to, and the treatment prescriptions that have to go with that. And so regardless if you have insurance or you don't have insurance, maybe this is a message for women, which is it's okay to be a little selfish for your health and your care so that you can do that for others. And it's really okay to sometimes put that ahead as a priority, because the results that we're seeing among some of the women that we see at the clinic can be very devastating. So, well,
that's a good tip. I hope people take to heart. But, talk about the situation with children, because it's sort of mind-blowing, the number of children who need help.
Unfortunately, Florida has some wonderful things about it. We have beautiful weather. We have the number 1 beach in the world. We have great people that live here, but we have some bad statistics that are associated with us as well. And specifically for children that are uninsured, Florida is 49th out of 50 in the country.
Say that again. What is that number?
49th out of 50th in uninsured children in the United States.
That is unbelievable, and not
bad.
Something we're proud of.
We shouldn't be proud of it. In fact, we should be embarrassed. And there are lots of resources for parents and families with children to seek out that the state has, like the Kid Care Program and other resources in our community, these kids should not be not immunized. They should not have their annual physicals. They should not be getting some of the most basic health care that they're entitled to as young children, that we have an obligation. You know, you can debate whether we have an obligation to take care of older adults or people like myself or you, but really when you're talking about toddlers, when you're talking about kids that are in elementary school, we have an obligation to take care of those people that can't take as well care of themselves.
So I hear you saying that there are things available. There are programs available and support available.
They're limited. Our state could really work to expand them, and that's where I think why we drop into that category of 49th.
So it's not an awareness issue necessarily.
It's somewhat of an awareness issue, but it's also a restriction. The programs are not as robust as they once were.
Okay.
I know in some of the recent work that's been done, particularly with children with disabilities, they're really working to eliminate or alleviate the waiting list. There's a huge waiting list for resources, and there's just not enough spots for the number of children out there that need assistance. And it's really on a continuum. You know, they say that spectrum from just a mild learning disability to a child with Down syndrome to a child that may, you know, have a feeding tube and need full-time care. There's a lot, and it's overwhelming for families. And when we see them, most recently, we saw a woman who had come here from Dominican Republic. She had a 3-year-old little boy with her, and she knew something was wrong, but she wasn't sure. She came to the clinic, and he had cerebral palsy and had never been diagnosed.
And cerebral palsy means lack of control of the limbs? It's a
motor and developmental disorder, so depending on where that is on a spectrum, it can be mild. But it can also be very severe. It happens traditionally with children that are born prematurely. It has to do with the deprivation of oxygen. And so that figures in. It's not a genetic disorder that you can inherit, something like that.
So the lack of diagnosis was simply because they hadn't been able to go to a doctor?
Correct. They hadn't sought health care. And she didn't know.
So you're dealing with overwhelming numbers of people.
Yeah, in 2015, we're going to record probably close to about 17,000 patients that we saw and provided medical service and assistance to. That's pretty overwhelming. Let me give you something you can compare it to. Our busiest emergency department here in Central Florida is Florida Hospital East, out off of Goldenrod. They had about 100,000 patient admissions into their emergency department. That's a big hospital with lots of resources and great physicians and clinical providers doing great work there. We saw 17,000, so almost a third of that.
And this isn't unique to Central Florida.
I think it's a little unique in our volume here because we have such an influx of people that come in and out. We're a very transient community. But certainly, you know, other parts of our state, Miami-Dade, the Tampa community, where you would expect to see pockets of population. But then we have instances like up in Daytona Beach where they actually have a high prevalence number of homeless, and they're struggling with how do you deal with that issue and health care at the same time. And there's very little resource there.
We'll talk a little bit about what's being done with the issue. I mean, we did talk, of course, about the funding from the legislature, but it's kind of more than that. So what's going on in our community?
Well, we're really fortunate in that we have a keen, I think, commitment and sincerity from our hospital leadership here, Orlando Health, Florida Hospital specifically, Nemours, Central Florida Regional behind them, that they recognize that they have a role to play in helping to keep our communities healthy and the people that live there. And so that's why they are, I call them investors in Shepherd's Hope. Whether it's their resources of their physicians, the diagnostic tests that we have to call up and ask them to donate to us, or the cancer treatments, or all of the different things that we receive from them. You know, last year, the in-kind contributions from our Florida local community hospitals was nearly $20 million. And I frequently say to them, we're a really good story for you, and the philanthropy that sometimes does not get recorded or given full due, because these men and women who come as volunteers and these hospital executives that pledge this support, they really don't want that recognition. They really tell us, we're happy to just be back here so that we can make sure, because it's also of value to them. right? If we can do something for these patients while they're at our level at Shepherd's Hope, maybe they won't go to the emergency department, which is the most expensive place you can go for your care. And maybe they seek and get care through us, and we can get them on a track where they don't develop into a chronic disorder. So you can see why they're partners with us, and we couldn't be more grateful.
It makes sense. It definitely makes sense. Outside of the medical community, do you have other partners that are sort of tackling different parts of the story?
We do. We're constantly seeking, and here's a story. This just happened today, as a matter of fact, as I was coming in for the interview. The number one item on our wish list. I often get say, well, what could we donate? Do you need a medical exam table? Do you need rubber gloves, prescriptions? What is it that you need? You know what I usually tell people I need more than anything else? Bottled water.
Really?
Yes. You know why? Because our patients can't make appointments to come to Shepherd's Hope, and we don't open till 6 o'clock. And frequently, they will start lining up between 1 and 2 o'clock in the afternoon to get their place in the line. And every day, starting at around May 1st until the end of August, it rains.
Mm-hmm.
And it gets hot. And we can see that, I just cleaned out my daughter's closet this week and took all of her winter clothes, and it's March, and I'm hearing people still talking about it snowing in other parts of the United States. And our groups here are talking about the beach. So our winter's done. It's 85 degrees outside, and while they're waiting out in the sun, they're thirsty. And so just today, someone texted me while I was on my way in to tell me that they were donating a pallet of water, that their church had raised some funds, $500, and they went to Walmart and they bought a pallet of water, and Walmart's going to deliver that to our clinic on Friday.
How cool is that?
That is so cool. And in some ways, I'm never going to not say we don't need dollars, because we do. But next to a bottle of water, when I hand that, or my staff hands that to a child or a patient that's waiting in the line that's been there for a couple hours, you might as well have just handed them the world. And they're so grateful. And we're really lucky that we can be in that position to offer it. So water and umbrellas, because after it gets hot and it rains, they're wet. And they can't come in our buildings because we don't open them until 6 o'clock, because they're not our buildings. We're taking them over from somebody else who's had their business open during the day. So they're wet and they're thirsty.
And so the buildings themselves are a partnership of sorts?
Yeah, and that's where a great facility collaboration. So, for example, up in Ocoee, on West 50, near Good Homes Road, we have a relationship with Vista Clinical Diagnostics. They're a lab company like Quest or LabCorp, where you can go in and get a blood draw. So they're open until 5 o'clock, and then at 5:01, they put their things away, and we take our things out, and we use their clinical exam rooms and some of their equipment to run our clinic. It saves us the cost of having to operate that ourselves, and so that's a huge in-kind contribution. Orange County government is another one that does the same thing. They operate a medical clinic on Westmoreland downtown. When they close at 5 o'clock, our team comes in at 5:01, and we run a clinic there 3 days a week. So facility in-kind is tremendous. Water, equipment, the clinical time, the volunteer hours. It's really amazing, the collaboration. I often refer to it as an elaborate quilt.
An elaborate quilt.
An elaborate quilt of people that care, from business entities that donate goods and in-kind services, to the clinical, to the hospitals, to the facilities. It's really amazing. Really amazing. Even when we put on our event, as I said with Mr. Rosen, he's helping to donate and offset some of the costs so that we can have that experience at a wonderful facility like Rosen Shingle Creek.
So let's go ahead and remind people about that. This is called the Call to Hope Fundraising Breakfast for Friend-raising.
Friends of Shepherd's Hope. It's going to be April 5th at Rosen Shingle Creek. Registration opens at 7:45 a.m. And it'll be a 1-hour breakfast that we'll provide. And you'll come to hear the hope of the stories of patients that we have helped, and the hope of the stories of the volunteers who have been able to provide that hope and healing, and our recognition of them for what that has meant to us in what we do at Shepherd's Hope.
And anyone can come and hear
Absolutely.
Those stories?
And you can register online through our website, shepherdshope.org. It's an online registration. It'll go right into our development team. Morgan will send you a response right back. to confirm your attendance, and we'll look forward to seeing you. We're hoping to have about 500 or more people there, friends, I should say, there. And we're looking forward to being just a wonderful morning.
Well, excellent. Listen, we've got a couple of minutes, and we've touched on several subjects, but let me throw it out to you. Where else should we go in this discussion?
Well, I really would like to go back to the mammography, right? So the bus is at Shepherd's Hope. Even though it's not October and it's not Breast Cancer Awareness Month, go get on a bus somewhere. Go get a mammography and have routine screenings. There are places across our community, if you can't afford or don't have insurance, you can call Shepherd's Hope and you can call the Florida Hospital Healthy Women 100 program. They have a grant with Susan G. Komen, and they'll provide the screening at no charge if the criteria is met. There really isn't an excuse for a screening not to take place for any woman right now that's over the age of 40, and it's a lifesaver. And that's not a small measure to say. And then screening for men as well. So I would say take care of your health. Remember that there should be care in health care. So when you're going to those providers, make sure there's some care there.
Well, thank you again for coming out today. I've been speaking to Marni Stahlman. She's President and CEO of Shepherd's Hope.